Hello, I'm Dr. Mark Dailey. Today I want to talk to you about a test you've done or are considering. I want to highlight why I recommend this test to some of my patients. It's called the organic acid test, and it provides a metabolic snapshot based on the byproducts the body discards through urine. These small discarded organic molecules are byproducts of human cellular activity, so they tell us a lot. The digestion of foods, the metabolism of gastrointestinal flora, and really at certain levels organic acids in urine may be indicators of toxicity or markers of the function of these specific metabolic pathways. Levels of yeast or intestinal bacteria metabolites, these are compared to normal levels of human metabolites, which provide an assessment of yeast and bacterial activity. The organic acid test includes 74 different urinary metabolites, which include creatine and two other neurotransmitter ratios. Recently, two new markers of genetic disease were added to the panel, one of which has been linked to autism. The organic acid test offers the most complete and accurate evaluation of intestinal yeast and bacteria. These factors are of crucial importance in neurological, gastrointestinal, and movement disorders. Abnormal toxic metabolites of these microorganisms can cause or worsen behavioral disorders, hyperactivity, movement disorders, affect energy levels and immune function. Yeast can attach to the intestinal lining, causing leaky gut syndrome, which can cause or magnify food allergies, impede absorption of vitamins and minerals, and cause intestinal disorders. Many people with chronic illness, allergic conditions, and neurological disorders often have one or more abnormal levels of organic acids in their system. Factors which can cause or affect the intestinal yeast overgrowth might include oral antibiotic use, excessive sugars in the diet, selective or combined immune deficiencies, genetic and other factors. Once any abnormalities are detected, there is a variety of options available to treat the condition. Treatment may include antifungal or antibacterial products, probiotic supplementation, vitamins, antioxidants, and dietary modifications. Patients and physicians alike have reported significant improvement upon treatment, which include decreased fatigue, regular bowel movements, increased energy and alertness, increased concentration, improved verbal skills, less hyperactivity, better sleep patterns, and decreased abdominal pain. Besides the new markers, the organic acid test still evaluates other important compounds like the Krebs cycle. The Krebs cycle is the energy producing cycle in your body. So it looks at those metabolites and even neurotransmitters. This reliable test detects the overgrowth of yeast and a bacteria species known as Clostridia, commonly missed by conventional culture methods. These organisms and other metabolites can produce or magnify symptoms of many medical conditions. Identification of a yeast or bacterial overgrowth paired with a successful treatment can increase the probability of recovery. So the clinical usefulness, again, of this test is to evaluate energy production, to assess central nervous system function, to evaluate the integrity of the intestinal wall, to reveal high levels of gastrointestinal yeast or bacteria, to detect nutritional and antioxidant deficiencies, to determine problems in the fatty acid metabolism, and to identify excess oxalates. So as you can see, this test can be very, very important. If you've already taken the test, this will give you a little understanding of what we're looking for. If you're considering this, hopefully you now see the value in it. If you have any additional questions, feel free to call our office. Thanks so much for your time and attention. God bless and have a great day.